Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Earlier this morning, I met with the Association of Restaurants Nova Scotia. I joined with them at their AGM, and I announced some positive news for the industry. Moving forward, Nova Scotians will be able to visit patios throughout the province with their companion animals, with their dogs. They'll have to follow, obviously, some safety protocols, but I think it's a great way to introduce a new policy to allow more people, and in fact, it'll help grow the business by 5%, I understand. It was an outstanding request and a really positive thing and a voluntary thing for restaurants to be able to welcome our dogs and our dog owners to our patios as we get close to patio season. Now let's get to the case numbers. We have 3 cases to announce today. One in the Central Zone and is a close contact of a previously reported case. Another in the Northern Zone under investigation. And the last one is in the Eastern Zone related to travel outside of Atlantic Canada. As of today, we have 24 active cases of COVID-19 and one in hospital. Last week, we delivered over 27,000 doses of COVID vaccines to Nova Scotians. That's almost 3 times as much vaccine as the week before. Last weekend, 17,000 vaccine appointments were booked. And I want to thank everyone, public health staff, volunteers, and our partners for working hard to ramp up vaccine delivery as supply increases. Over the last couple of days, about 12,000 appointments for the Pfizer vaccine became available to book, and we added 21 more pharmacy locations across the province. We're expecting a Moderna shipment later this week, and we'll be in a position to add more appointments and more locations. If you're 75 or older and you haven't booked an appointment, or if you're booking for a loved one and haven't done so yet, please book online or call. So far, nearly 68,000 appointments of 78,000 available are booked over the last 2 weeks. There are appointments left across the province, and if the clinic you want is full, there'll be more appointments soon. I also wanted to share an update on the African Nova Scotian community clinics. Our team is working closely with community leaders across the province from African Nova Scotian communities. Leaders like Reverend Leonard Anderson from the Emmanuel Baptist Church. He announced to his congregation on Sunday that they'll be hosting a clinic starting on April 8th. This clinic is for members of the community who are 55 and older. The Association of Black Social Workers will be calling people directly to book appointments. We're taking our lead from the community to ensure that people come and get vaccinated. That's our priority. Another clinic is planned in the Preston Township at the New Beginnings Ministry on April 13th and 14th. And planning is underway for clinics in other African Nova Scotian communities and will be shared once finalized. I also wanted to share some news. The first is the expansion of virtual care, a positive outcome from the pandemic that has seen broader use of virtual care in Nova Scotia. In 2020, 1.5 million healthcare services were provided through e-visits with physicians. We're extending this service until March 2022 while we complete an evaluation to help us finalize a permanent long-term approach. This will help Nova Scotians more easily connect with doctors and healthcare professionals. In other parts of Canada, we are seeing an increase in positive cases. We have to remain vigilant in Nova Scotia. We have done so well, but we have to hang in there for a while longer. And with that, I'll turn it over to Dr. Strang.
Thank you, Premier, and good morning, everybody. I want to start by talking about the news that came out yesterday around Astrazeneca Vaccine. In the past few weeks, there has been an increasing number of reports from Europe of rare but serious cases of blood clots associated with low levels of the cells that help the blood clots, platelets. And this is following immunization with Astrazeneca Vaccine. Most of the cases have been in women under age 55, and about 40% of them have died. At this time, a definitive link between the vaccine and the blood clotting events has not been made, but it is very suggestive, the evidence to date. We know that so far there have been no similar blood clotting events reported in Canada, and no blood clotting events reported anywhere in the world with the mRNA vaccines. Health Canada announced yesterday that it is requiring AstraZeneca manufacturers to conduct a detailed assessment of the benefits and risks of the vaccine by age and gender in the Canadian context. Health Canada will use this information along with further international evidence to determine if additional regulatory actions are necessary. In the interim, the National Advisory Committee on Immunization has recommended an immediate pause on the use of AstraZeneca vaccine in all individuals under age 55 in Canada. Canada's Chief Medical Officers of Health are fully supportive of this recommendation and are collectively taking action in each of our own provinces. Anyone 55 or over can still get this vaccine if given the choice, as the benefits of getting the AstraZeneca vaccine outweigh the increased risk of COVID-19 in older adults. This change does not mean that the AstraZeneca vaccine isn't safe or isn't a good vaccine. It means that we are seeing something rare in a certain subset of the population that we need to monitor and get more information about. Until we do that, the safest, most transparent thing to do is to limit the use of the vaccine. I know that this is maybe scary for people, especially if Nova Scotians have had their first dose of the AstraZeneca vaccine already. But we're fortunate that in Nova Scotia, our use of the AstraZeneca vaccine has been focused on those aged 60 to 64, which is well within the age range recommended for use. And when we get more AstraZeneca vaccine in Nova Scotia, we will continue to focus on the ages 55 to 64 for those who feel this vaccine is right for them. Anyone who has received the AstraZeneca vaccine in the last 20 days and anyone vaccinated with it going forward should monitor for symptoms and seek immediate medical attention in the unlikely event they develop any of the following: shortness of breath, chest pain, leg swelling, persistent abdominal pain, sudden onset of severe or persistent worsening, headaches or blurred vision, and skin bruising other than at the site of vaccination. We will have this information on our website. We're in the process of sending out detailed information to healthcare providers on this in the Nova Scotia healthcare. And all those symptoms I listed, in anyone with these symptoms, whether they have recently received the AstraZeneca vaccine or not, these are serious symptoms, and anyone getting these should seek urgent medical attention. The response to AstraZeneca is exactly how the safety system is meant to work. When we have a serious safety signal, we will take precautionary steps and continue to monitor evolving science and evidence. And we will Nova Scotians informed about any significant adverse events that may impact the use of the vaccine, so Nova Scotians can make informed choices. I'm going to move on to talk about our recent cases and variant cases. In the past few days, we have identified more cases of the COVID-19 variants. To date, we have had 17 cases of the UK variant and 10 of the South Africa variant in Nova Scotia. Thankfully, we've not seen community spread associated with these cases. The exposure notice issued for the Kings Wharf condominium complex in Dartmouth over the weekend has seemed to create a bit of a stir, given that the advice to get tested was connected with the discovery of a variant case. But I want to be clear that the approach taken in this situation is the same approach that we've taken multiple times in the past few months. When we see a cluster of cases, we inform people in that community and ask for them to get tested. It just so happens that the community we're talking about now is a number of high-rise buildings, but it is the same as any other community that we've been working with. So people linked to Kings Wharf who are getting tested do not need to isolate while waiting for test results. They can keep going to work, school, and be out in the community. And there is no public health reason for the restaurants, gyms, and other businesses at the Kings Wharf complex to be closed. So in closing, I'd like to recognize some special holidays that are coming up. I'm very happy that our low case numbers mean we can safely celebrate Passover, Easter, and Ramadan. These are significant events that involve getting together and sharing meals with family and friends. Unfortunately, they are not immune to COVID-19, and we must remember to keep our celebrations safe. So please, keep to your close social circles. Be careful about shared food and drink. Wash your hands often. Wear your mask when you can't be physically distanced. And most importantly, even if you may have a family or some kind of social event, if you're feeling unwell, please stay home. We're in a much better position this year than we were last year during this time, but COVID is still around us. So please, we need to make we need to do our part to make sure that COVID doesn't have a chance to spread within our families, friends, and communities while we mark these special holidays. Chrissy.
We'll take one question and one follow-up in the time that we have for today, beginning with Shayna Luck with CBC.
Dr. Strang, on the AstraZeneca front, in the technical briefing that you gave us, it seemed like you were expecting AstraZeneca deliveries to ramp up quite a lot in June, when you'll be vaccinating mostly under 55. So I'm wondering, if we're not able to use AstraZeneca for those folks, how does that affect our timeline for rollout?
So AstraZeneca was only ever going to be a small portion of our vaccine supply. We haven't got final confirmation yet, even in the next few weeks, about what exact amount of AstraZeneca we're getting. So we've always built our planning based on the major proportion of what we're getting will be the mRNA vaccines. If we aren't able to use AstraZeneca at all, that may push out our timeline a little bit. But right now, we're the group that we're using AstraZeneca in. We can, as the evidence right now says, we can continue to use that vaccine in that age group.
With your follow-up, Shayna.
And if we did have to push out the timeline by a little bit, how would you quantify that? What's a little bit?
Until we actually get, and we understood exactly what AstraZeneca we were going to get. We know. I have to back up. We only know 2 weeks out in advance with certainty what we're going to get. The rest is projection. So we would, if it turned out we couldn't use AstraZeneca, we would go back and redo all that modeling and planning, and we'd be able to come back and say, now here's what our timeline will be. But we're working under the assumption that we will continue to be able to use AstraZeneca, at least in moving forward. Currently in the 60 to 64-year-olds, there's still a large number of people even in that age group who haven't had a chance to get AstraZeneca and are still waiting to get their mRNA vaccine. So, as we get more AstraZeneca and we're able to use it, then we'll continue to focus on that age group.
Next question will go to Alicia Draus with Global.
Given that individuals who are older, say in that 55 to 64 age group, are in general more at risk of blood clots, why are they still able or recommended to get AstraZeneca versus the younger age group?
So first of all, we know that actually it's in younger, especially women, who have a higher risk of blood clots for other around related to hormones and other things. So your initial statement isn't actually correct. We also know, looking at the epidemiology of this, it seems to be women under 55, or mostly women under 55. We had a lot of conversation on the weekend around this, myself and my colleagues, talking with experts across the country, that part of this is what is the risk benefit. As you get 55 and above, it seems that there's a much lower risk of this. It's a very specific type of blood clotting. It seems like there's much lower risk of that happening. And the risk of getting serious outcomes from a COVID-19 infection starts to substantially increase. So the balance of the risk benefits is part of this. And all the experts and my chief medical officer of health colleagues were very comfortable where we landed in saying that for people 55 and above, that AstraZeneca is still safe to use because the balance of that risk and benefits different when we're talking about people under age 55.
Go ahead with your follow-up, Alicia.
And if individuals who have already received the vaccine and are feeling uncomfortable or hesitant about now getting that second vaccine, what would you say to them?
So we know that they're not due for their second vaccine. We've only started using it in the last couple of weeks. So it's probably, it's 14 to 16 weeks before they get their second vaccine. I fully anticipate we'll know a lot more about this, the science on this. So we'll be able to make more precise recommendations on their second vaccine when they get close to needing to get that second vaccine.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Dr. Strang, you sort of touched on this. I'm just hoping to get a bit more about understanding why AstraZeneca is right now only recommended for such a narrow age category between 55 and 64. You've explained a little bit about the blood clotting risk, why not older, and why just this sort of narrow grouping.
So we have to understand the recommendation for AstraZeneca. There's still from NACI. There's still a preferential recommendation that over age 65, there's a preferential recommendation for mRNA vaccines, if possible, simply because of the increased risk of severe outcomes as you go 65 and above and start to get older, and the evidence of increased effectiveness from mRNA vaccines. So NACI has a preferential recommendation. So that's why we're targeting in this narrow range group. We'll continue to target the 60 to 64-year-olds. We could, if we meet the demand, if the demand is for AstraZeneca in the 60s to 64-year-olds is finished and we still have AstraZeneca, we can open it up to the 55 to 60-year-olds. But we're going to continue to offer it to 60 to 64-year-olds as we anticipate getting more AstraZeneca vaccine in the near future.
Go ahead with your follow-up, Lindsay.
Thank you. And a question for the Premier regarding your announcement on virtual care. This is certainly welcome news. Doctors have been calling for this to be made permanent as it stands. I'm wondering if you can lay out what is needed in this review process, and can you say if the current structure for virtual codes for these appointments is likely going to be just made permanent in this move?
Yeah, so there's benefits obviously that we need to look at, and those benefits are that it limits travel, allows more appointments, but at some point you have to look at the evaluation of what procedures that you need to do in person, and how that fits with how the package of how doctors are compensated, whether that's fee-for-service or on a salary mode. There's differences of how everyone is compensated, and how the virtual model could actually fit into the whole system in a more long-term perspective, and how the costs to government are associated with that, ensuring that we do get the value for money, ensuring that the patients get the best service possible.
Next question will go to Tim Biscay with the Halifax Examiner.
Premier, it's impossible to miss that there was just a large demonstration, or at least a loud one, before the meeting. As I understand it, the folks demonstrating are upset that the Leahy recommendations haven't been implemented, and they call it log and talk, or talk and log, and that the Biodiversity Act has been gutted. What do you say to people who say that you've simply caved to the big forestry companies?
So I did go up and get the letter, and I haven't read it yet. Just before entering the room, I'll have a look at it, and I listened to all views on this matter. I've been the minister in the past, and I know that there's been some challenges getting through different recommendations, but some recommendations actually have been implemented. We actually just fulfilled another one by introducing the Crown Lands Act. First time getting into the legislature, we brought that in. That's a foundational piece. We're going to continue to implement the report. The report does not ask for a moratorium on clear cutting, nor does it actually recommend eliminating clear cutting. So I think that for those that are really interested in evolving to ecological forestry, they should read the report, and they should go over the different aspects that actually allow us to get to ecological forestry by working together and by sustaining the industry in the long run.
Go ahead with your follow-up, Tim.
I've asked you previously about the Goldboro LNG plant proposal. In the wake of that conversation, some people who have expressed their democratic support or opposition to the plant were sent letters basically threatening them with legal action for expressing their democratic right to speech. Will your government support and introduce anti-SLAPP legislation to prevent these kind of cases?
So I think that the democratic process should allow for that type of criticism, protest. I think that's all healthy to democracy. We can look at legislation, but I haven't really reviewed what that would mean. But I think that sometimes conversations need to happen when there's projects like this, and there's going to be different views, different opinions on matters of this magnitude, but we do need economic development in the province. We do need better laws to protect the environment. I think we can do both. I've ran on a platform that respects the way that we grow the economy, that uses our natural resources. But I think there's a lot of work we need to do to ensure that they're utilized more sustainably. That speaks to forestry, that speaks to energy, and I have a commitment, and I'm going to meet my commitments to getting off coal by 2030, of reducing clear cutting, ensuring that we have industry for the long run in this province, and I think that Nova Scotians, by and large, want to see both, action on both files.
Next question will go to Sarah Plowman with CTV.
These are for Dr. Strang. I'm wondering if we know if people have been canceling their appointments to get an Astrazeneca vaccine since yesterday's news. If so, about how many people? And what's your message to someone who has canceled their appointment or is hesitant to get this vaccine at this point?
It hasn't been brought to my attention that we've had any substantive cancellation of the Astrazeneca vaccine. For people who are concerned, we're giving people very much an informed choice. So we have information at the time online to help them make their decision, as well as when they show up to get vaccinated, an informed consent process, which clearly outlines what we know about this rare blood clotting event, and we'll continue to inform Nova Scotians. Ultimately, they have a choice. But as I said in my remarks, that we very much believe, along with my other Chief Medical Officer of Health colleagues, that the balance of risks and benefits when you get 55 and above certainly is very much in the balance of receiving the Astrazeneca vaccine, because the risk of one of these rare events is everything we know to date is much lower in this age group, and they're at increasing risk for significant complications or severe illness from COVID. Ultimately, they can make their choice about whether they're comfortable getting the AstraZeneca vaccine or waiting for the next few weeks until they're able to get one of the mRNA vaccines. We're in a very fortunate position that from the very beginning we've given Nova Scotians information on the AstraZeneca and allowing them to make a choice about which vaccine they choose to get and when.
Go ahead with your follow-up, Sarah.
And despite administering several thousand vaccines last week, it seems that we're still last in the country. People I speak with are anxious to get their vaccine. So what's being done to speed up the rollout here, and what do you say to people who are critical that this simply isn't happening fast enough?
Well, I think first of all, if you look at the numbers, it depends how you look at them. Much of it is on the national website, is out of date. If we look at the progress we've made in the last 2 weeks, we presented information at a technical briefing. We're on a very rapid upward climb in terms of the number of vaccines that are getting delivered, a record number of people immunized next week, and we'll surpass that in the weeks ahead. We're very much on target, always dependent on vaccine supply, but we're very much on target to be able to get all adult Nova Scotians their first dose of vaccine by the middle of June. And we're rapidly expanding both access across the province to vaccine, as well as the number of vaccines that are available as our supply increases.
Next question will go to John McPhee with the Herald.
Thank you. This is for Dr. Strang. There have been several cases recently that are in the under investigation category, including one today in the Eastern Zone. Are you concerned at all about these cases when there's not an immediate source that has been identified, or is this kind of par for the course when we have, several cases reported?
So some of it could be a time lag, that maybe that case was reported very late yesterday or some point of today, and we haven't even completed our basic investigation. But it also may mean that it's not apparent right away that it's a traveler or a known contact of a close case. So we have to do a little bit more investigation. As we're learning, most of these cases we're actually able to link, as we do our investigation, we're able to link them to previous cases and come to a satisfactory conclusion. But not all. always. But that's only one piece. I also look at each of these. I look at how do they link to other cases, and if there's a case of where we can't make a definitive conclusion on the source of exposure. Are we seeing other cases in the surrounding community? And if we are, we always move in like we did with Kings Wharf. We move into the community with a broad sweep of testing. And every time we've done that recently, we're satisfied that even though we may not be able to ultimately define where the case came from, we've done a lot of testing and we're not showing additional cases that we were unaware of. So I'm very comfortable with our process to deal with these, and all the testing, all the epidemiology and our case follow-up. We're repeatedly, even when we have concerning signals, we're not showing unrecognized spread within our communities.
Go ahead with your follow-up, John.
Thank you. This is again for Dr. Strang. We had a question from a reader who's wondering regarding the asymptomatic testing, how often it is enough? Like we haven't had any advisory, like you said, make it part of your routine, but should this be done every month, every few weeks?
That depends very much on an individual. My basic message is that for people who have a lot of contacts in their life, whether it's because of work, they're around a lot of people, or their social activities, they're around a lot of people, they should do it on a frequent basis, perhaps even weekly. For other people who have much less activity, much less exposure to others, they can do it less frequently. But ultimately, we ask all Nova Scotians to think about building asymptomatic testing based on their level of their understanding of their risk as part of their COVID protocols. And we encourage everybody to come out and do that asymptomatic testing. Ultimately, people will choose how frequently we do that.
Next question will go to Danielle Edwards with the Canadian Press.
Hi, this question is for Dr. Strang. I just wanted to ask, since we're seeing a few more cases popping up in New Brunswick, if there are any conversations happening about the upcoming plan to reopen the Atlantic bubble.
So maybe I'll start. I mean, we continue to work. My epidemiologists are in ongoing discussion with the New Brunswick epidemiologists. I look every day at the New Brunswick cases. When I look, what I see is that, yeah, they have still, I think on the weekend there was 12 on Saturday, 6 on Sunday, but all of them are still in the Edmundston area, town of Edmundston and surrounding communities. There's no sign of that outbreak in that area spreading to other parts of New Brunswick. As I said last week, that would be the trigger where we'd want to reconsider what our approach to New Brunswick is. But at this point, that cluster or outbreak has been confined in that very specific area of northern New Brunswick.
Go ahead with your follow-up, Danielle.
And just a little bit more about the Astrazeneca vaccine. I just wanted to ask what the messaging is to people, like it's been asked before, who might be apprehensive about getting that particular brand of the vaccine. I know previously you said that the best vaccine to get is the one that's most available to you, but just in case there are concerns, what would you say to someone who is concerned about getting AstraZeneca?
So we're fortunate that we're giving AstraZeneca to 60 to 64-year-olds. As I said earlier today, that we recognize that people have concerns, but in that age group, very clearly the balance of the benefits far outweighs any potential risk of very rare complication. And then ultimately each I'm very safe in saying to Nova Scotians 60 to 64-year-olds, it's safe for you to get AstraZeneca. It'll be safe for you to get Pfizer or Moderna. Really, you have to make a choice about whether how urgently you feel you want to be protected against COVID, and if you have the ability to make a choice about getting AstraZeneca very soon or waiting a few weeks and getting the Pfizer or the Moderna vaccine. But either of them are safe within this age group.
Next question will go to Victoria Walton with the Coast.
Thanks. This question is for the Premier. In regards to this new regulation around dogs on patios, I mean, everyone's really excited to be able to bring their dog this summer. But I'm wondering, for people with accessibility issues, wheelchair users, a lot of patios still aren't accessible to them. And in addition, people who use like guide dogs could be really distracted by having all these other dogs there. Have you made considerations for people with disabilities?
So in terms of accessibility on our patios and restaurants, that was considered with the legislation that we brought forward to have our province fully accessible by 2030. There's still a lot of work underway with the directorate. There's resources in this budget. It's a really important commitment that we continue to work on as a government. With respect to the dogs being enabled to legally be on patios, as you probably know, especially in the Halifax area, there are patios that use it outside of the immediate space of their restaurant. So this allows policy to catch up with the reality that people want to use space in a public setting with their dog as long as it's safe. There are a number of measures that need to be followed. The dog has to be on leash, number one, to avoid distraction with other dogs, and there's safety around food requirements. There's signage. There's a number of pieces for better protection, and it aligns with the different provinces that have already made this pass in their jurisdiction.
Go ahead with your follow-up, Victoria.
Thanks. And this question is for Dr. Strang, but we said that there's a shipment of Moderna arriving later this week. Is that the one that was delayed originally, or is this another shipment?
That was the shipment that was delayed originally.
We'll have a few more moments for a couple more questions. We'll go back to the room to CBC's Shayna Luck.
Dr. Strang, with the messages around AstraZeneca coming across as a little bit mixed, is there any consideration being given to stepping up public relations campaign or making this more accessible to people just to try and get them over any hesitation they might have?
So we're working today. I mean, this all unfolded yesterday. We're working today to get more information on our website. We're also working to get a bulletin out later today to healthcare providers so they have more information if patients are coming to them with questions as well.
Move on to Alicia Draus with Global.
Dr. Strang, many European countries put pause on AstraZeneca weeks ago already because of this blood clotting issue. And obviously we were hearing about it, but we were still continually reassured that it was okay and it was safe. So I'm just wondering, why has there been such a delay between our reaction to, again, what Europe had been doing weeks ago?
So the initial countries in Europe actually were putting it on. There was a general type of blood clotting, called thrombosis. It's been much more recently that this very specific central venous sinus thrombosis has become an issue. And it's evolved in the last couple of weeks. We've been watching it very carefully. So it's a very specific type of blood clotting, which was different than the initial signals. So we've been watching it very carefully. It's still there's a lot of unknown questions about it, but there's enough evidence now that the decision was made over the weekend with Health Canada, with NACI, with the Council of Chief Medical Officers of Health, is that we had enough evidence, even though we had a lot of outstanding questions, that we were going to take a very cautious approach, pause for those under 55, because of this very specific signal around this central venous sinus thrombosis, not the general thrombosis, which was the initial signal a few weeks ago.
Moving on to Lindsay Armstrong with All Nova Scotia.
Thank you, Dr. Strang. I'm wondering if you have any concern about our ability to use the 38,000 AstraZeneca doses that I understand are expected to arrive next week from the federal shipment, given that I know it's a shorter shelf life for these doses compared to the Pfizer Moderna.
No, as far as we're still waiting final confirmation of that. My understanding is that also that we're going to have a much more extended shelf life for any additional AstraZeneca we're going to get. The initial 13,000 we got was expired April 2nd. So any additional vaccine, is my understanding, is going to have a much longer shelf life and will have much greater ability to have it out there and to be used.
Next question goes to Tim Biscay with the Examiner.
Dr. Strang, with regard to Kings Wharf, lots of people are commenting to me that given that you're asking everyone to get tested, and there's a large population there, why not bring a mobile testing site there to Kings Wharf?
but that's certainly, we talked about it. We have lots of access in primary assessment centers on both sides of the harbor. So knowing that it's not just people who live there, that anybody's visited there. So we wanted to maintain, the health authority has built extra capacity within the existing primary assessment centers. If there's an ongoing demand and we need to bring in a mobile unit, we can do that. But we're certainly not hearing any significant issues that people are having difficulty accessing the existing primary assessment centers.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, everyone. Each and every day, we see good progress on our vaccine rollout. But everyone has to keep in mind that our plans are dependent on the supply from the federal government. When we get vaccines, we use them, and we use them as quickly as we possibly can. Good news, again, with low case counts today. Let's keep it up. Remember to wash your hands, respect physical distancing, and wear your mask. And now you can bring your dog to a nearby patio that will soon be opening. Thank you. And Rocco lives with his grandparents in Antigonish.